Scientific research results have been already used at the front line, so scientific research is closely related to the frontline treatment and prevention control, and it is our priority to advance and to apply the available technologies to the frontline in order to help with these efforts. So first of all, in terms of the tracing the source of the disease, we have dissected and separated this coronavirus and have finished gene sequencing at an early stage. In terms of clinical treatment, the diagnostic kits or PCR is already being widely used in the diagnostic process. A series of antivirus drugs have been selected and is now undergoing clinical trials. In terms of improving the successful rate, we are carrying multiple projects at the same time. With CNG and CCTV. With the rising number of discharged patients, a lot of people are also concerned with the recovery rate. So how long does it take to cure one patient? And what is the recovery rate of this disease right now? In order to improve the recovery rate, one thing must be clarified. We do not have a clear equation for this calculation of this number, but there is some statistics I can give to you. As of now, the total hospitalized time is 5 days. The shortest 5 days in Hainan province, and 12.5 days in Guangdong province, and in average it is a bit more than 9 days. That is the national average. In Hubei province, it is in average 20 days. So for most patients outside Hubei province, they can be discharged in a relatively short period of time. That means that our treatment plan is quite effective. But in Hubei province, the time is substantially longer because in Hubei province they have more critical cases than any other provinces. And second, the standard of discharging is much more strict than that of other places. So in other places, the discharged standard is that the patient must show 2 negatives of a nucleic test and one with an interval of 24 hours. But in Wuhan, the standard is much more strict because the patient, even the symptoms are gone and he has passed nucleic test, he also need to stay in the hospital for 10 more days before being discharged. So we see a very small number of people discharged from the hospital, not because our treatment is not effective enough, but because the patients are kept in hospital for 10 days just to be safe. And we are also doing this kind of trace-back research on the cured patient in hospitals in order to further optimize our plan of treatment and diagnosis. So we are doing a lot of follow-up research at the clinical level, and we are doing by learning. We also use the cocktail measures combining TCM and Western medicine. So the function of TCM is crucial in terms of ease the symptom and reduce the possibility to prevent light syndrome from developing into critical condition. We have a lot of clinical statistics to support that. Our colleague from MOT also mentioned that you might see a lot of reports on media giving a lot of so-called plans or treatment diagnosis in terms of this. Some of the so-called useful or effective measures are done in lab and in terms of cells. But for that to go to real human body or go to the clinical stage, it still takes a long time to go. In terms of this time, we are trying our best to reduce this time of or extension that goes from lab to clinics. So everything has been sped up, has been expedited in terms of treatment plan or the use of drugs. We are expediting the process so that most effective treatment can be applied to our patient as soon as we can. We have also deployed a lot of medical professionals from all over the country to fight along their Wuhan colleagues in order to improve the discharge rate. So a lot of people focus on antivirus treatment. Of course, that is important because that is an important measure to eradicate the causes of the disease. But is there anything else that we can do besides giving them antivirus drugs? We also have other supporting treatment. We call it a comprehensive treatment or cocktail treatment, including life support treatment, the use of ventilators, and blood filtering or ECMO equipment. So all of these life support treatment plus TCM and Western medicine as well as antivirus treatment is a portfolio of treatment that we're using right now. And our number of discharged patients has already surpassed the number of deaths for several days now. We might experience some fluctuations later on. However, the effect of this kind of cocktail treatment is already showing effect.
谢谢主持人，我是香港有线电视的记者。
With Hong Kong cable TV. Today, in Hong Kong, a 39-year-old man was called death. He was well when he admitted he was a life syndrome patient, but today he suddenly passed away. So, is there similar cases? Are there similar cases in the mainland? So, is it possible to become a trend? And second question is about the diagnostic kits. So, I heard that one of the patients in Tianjin showed 3 negatives before diagnosed as confirmed cases after a fourth nucleic acid test. And a patient in Japan will now be choosing to strengthen its diagnosis. So, is there anything that we can do to improve the accuracy rate in terms of nucleic test? I didn't know the specific situation of the Hong Kong patient. But it's possible for the severe cases to gone bad, and all of a sudden, this is most probably because this patient carries with him some intrinsic diseases of his own. In SARS, there are also patients that was physically well, but experience sudden turns of events in a very few hours. These are very rare cases, but they did exist. Anything could happen. In terms of nucleic acid test, as far as we know, this is has quite high sensitivity, but they also have a lot of factors that might affect the result. For example, whether the samples were standardized, and whether the testing facility is the process is standardized enough. Another factor is that because this disease shows a lot of pneumonia-related symptoms, so we want to remind our medical workers to take the samples in a standard manner, and the result, the accuracy is higher in terms of pulmonary samples that is taken from the lungs of the patient. The accuracy is higher than that of the samples taken from the throat of a patient. So this kind of standardized taking of samples for testing is crucial in terms of maintaining the accuracy of diagnosis. With Global Times, I want to ask about the medical supply, including masks and protection suits in epicenter, and what are the measures that are taken to protect the medical workers from being affected. Right now, the supply of protection materials is still very tight, especially in the epicenter Hubei and Wuhan. So before we send our medical teams, as of tomorrow, we are expected to send a total number of 10,000 medical professionals to Wuhan. Before sending these medical teams, we will require them to carry as much protection gears as possible with them, so as to ease this very tight supply, this undersupply situation in the epicenter. However, we still have a undersupply situation, and all departments are working collaboratively to restore production. Currently, our capacity has been restored. And 2 days ago, I think my number is that 40% of the capacity has been restored. I believe that as of today, this percentage will be increasing, and we are also increasing exports as well as receiving overseas donations. So through multiple channels, relevant departments are trying our best to address this insufficiency of medical materials, and the capacity and productivity in Hubei province is also increasing. I think the biggest gap still exists in N95 and medical protective suit. These are very precious medical resources that has to be used wisely. So the MIT, the Drug Administration, and AHC are working collaboratively on the categorization of using these protective gears. We have issued a guidance on using protective gears in clinical treatment, mainly specify the utilization of 8 medical gears, the scale of their use, the time of usage, and how to change in and when to change out of these gears. For example, in isolated wards, in isolated wards for critical cases, or in isolated ICU, and in other regions of the hospitals, we have very specific guidance. So it's not necessary to wear an N95 or wear protection suit everywhere in a hospital. So we must use these resources wisely and economically. And according to this guidelines, the medical institutions have to use these materials wisely and give priority to the key areas, the key zones, wards, patients, as well as medical professionals. I understand that our medical workers are working extremely hard, especially for those who are working in isolated ICU. They are expected to work 4 hours per shift, which is really hard. Some of them even wear diapers into the ICU so as to reduce the times, the bathroom times, because each time he goes out, he will have to change into new suits. That's some extra consumption. So they eat as less as possible, they drink less water as possible, and spend 5 to 6 hours inside the ICU every shift. So we do not recommend them doing so, but we understand the reason why they do it, because there's specific time of protection for these protection suits. That's why we still need to increase the productivity of these protection suits so as to realize the utmost protection for our medical professionals. That's why we have issued this guidance of using protection gears and handling, as well as how to wear them and take them off. During SARS and this time, we have always been stressing that sterilization of the hands cannot replace hand washing. So you're not safe even after you have dressed yourself with protection suits. Therefore, we have to continue to improve the awareness and protection of our medical staff. We also need to guarantee enough rest for our patients, which is really difficult at this stage. Most of our medical workers are under extremely high pressure and stress, and their immune system might take a toll on it because of it. And they might be subjected to getting other disease. So we need to have a more scientific rotation of our medical workers to ensure their mental and physical health, so that they can be healthy enough, they can be robust enough to fight alone in the front line. With Technological Daily, my question goes to Ms. Sun. You mentioned that the research of drugs is one of the hottest topic, and there is a drug that is supposed to be useful, that is called Redshift. So can you tell us more about this? In terms of the research of medicine, it is one of the 5 key aspects of our ministry. In terms of research in this regard, improving the treatment the healing rate and reduce mortality rate is our goal, but the research of a new drug is it takes a long time and it takes a lot of research. That's why we have organized a panel of experts to do the research of new drugs at one hand, but I think more importantly at this stage is to do the selection and screening of the existing drugs. And we need to select a few these types of drugs for clinical trials that can guarantee safety and efficacy at the same time. We have made some success. Besides remdesivir, we have also chosen other several types of Western drugs, as well as TCM. For example, one of the drug that is anti-malaria drug is proven to be useful in the treatment of a coronavirus pneumonia, but we still need further research before we put it into clinical practice. In terms of the drug that you have just mentioned, remdesivir, we have done systematic evaluation of this drug. This drug is widely used for treating Ebola patients, but not all of the clinical trials in other countries have finished their clinical research. It shows very good out-of-the-body diversity, and two research institutions, including CES, has been commissioned to conduct clinical trials. Besides the research of these drugs, we also have plans, emergency plans, to strengthen our research in this regard. The scientists are basing their research on scientific techniques, including research on the treatment using stem cells on the patients. We are also looking forward for more scientific results that can bring hope to our patients. The scientific workers are also working at the front line. I believe that scientific innovation will be effectively supporting the treatment of this control and prevention of this disease. We have taken notice that in some regions of Hubei province, we still see an uprising of confirmed cases number. So in the epicenter, is the capacity at the fever clinic enough to see to all of these patients? According to available statistics, in the 31 provinces and regions, we have altogether 15,000 fever clinic and 1,092 designated hospitals, and the number of the treatment receiving diagnosis in the fever clinic is important for us to project the direction of this epidemic. So we have a daily report system calculating the number of patients at the clinics. According to latest statistics, that is as of yesterday. At national level, all the number of patients going to fever clinic amounts to 210,000, which is down by 7%. Actually, we have seen a steady decrease of clinical patients for several days. For those kept for medical observation, the number amounts to 10,000. As of 24 o'clock yesterday, there are still 300,000 people still kept in the fever clinic for observation, which I believe would be the main source of suspect cases, from which we will be having a number of confirmed cases. In the province in Wuhan, we are still seeing an increase in terms of clinical patients, but we see that the growth rate has been slowed down in recent days. And currently, 194 more people are kept for medical observation, which is also down by 94 people compared to the previous day. So the workload or intensity at the clinics has been reduced. However, in the epicenter, the workload is still higher than that of any other places. Winter is, of course, itself a flu season. So how to treat more patients as possible? Frankly, right now it's very difficult to get a hospital bed if you are infected, so we are trying our best to increase the number of beds. We have a daily modulation of medical resources. For example, the number of beds that can be open and the number of gap and the demand. So the gap of the hospital beds is still very huge. But the good news is that the number of medical staff is sufficient as of now to see to all of these patients. We are trying our best to increase number of beds in designated hospitals. Huoshishang Hospital has already been put into use, and very soon, Beijing Hospital will also be put into use. You might have also taken notice that many public facilities were now being renovated into field mobile hospitals to take in suspected cases and light syndrome patients. In some sports centers, in exhibition halls, they are being transformed into field mobile hospitals, which is a collective isolation location for these potentially infectious patients so as to reduce the risk of community dissemination. But that would also increase the demand of medical resources, which in turn will widen the gap of undersupply. So yesterday, we have further mobilized the resources to construct the field mobile hospitals, and 20 mobile hospitals are being transported to the city of Wuhan to treat the light syndrome patients. Altogether, 600 medical workers will be working in these mobile hospitals. And we have also deployed 1,400 nurses. We also, from China CDC, from the China Scientific Academy, and have transferred 3 mobile P3 labs.
那么要通过这个 P3的实验室呢，它目前主要是在3个区域，所以我们调集了3个 P3。那么这些方舱医院和这些护士呢，主要的就是要补充到这个3个集中收治这些观察病例和轻症的疑似
serve as a supplement to the treatment and diagnosis in these field mobile hospitals. Hopefully, through our efforts, we can admit as many patients as possible. With China Daily, according to available statistics, there are around 2,700 severe cases. Most are senior citizens and elderly populations. So what are the measures taken to treat these patients? This is a coronavirus disease. The most effective one would be antivirus treatment. But currently, we do not have one effective antivirus drugs, and like many other virus-related drugs. So our treatment is still this syndrome-targeted and supporting treatment. For general light syndrome patients, we mainly ask them to take some drugs and rest well. For severe cases, however, it's mainly about life support. We need to conduct a collective treatment, to organize the ICU team, to mobilize high-quality medical resources, to provide ventilators and other life support equipment, and try our best to help them recover. So what we can do under such circumstances is to help the patients to restore his physical balance so that he can pull off this most severe time of his syndrome. That's the best we can do. So our medical professionals are trying their best to help our severe cases patients.
谢谢中国人口报记者提问。刚才提到这个 N95 口罩的供应保障问题。
We mentioned the undersupply of N95 masks, and there are calls on the internet to recommend the general public to wear the disposable medical mask and leave the N95 mask to the medical workers. So what do you think of this kind of appeal? People are also concerned with the situation of pregnant women. So can you tell us more about that? In terms of the reasonable usage of the mask, we appeal that people use this mask wisely, especially under such a circumstance when the resources are quite scarce. So for different risk groups, NHC have compiled this guidance on the protection measures of different risk groups and a guidance of the mask utilization. There are very specific instructions in terms of how to use the mask and what kind of masks to be chosen. There are 4 types of masks. First is disposable medical mask. We recommend the public to use them in not so crowded vehicles, public transport, for example, or you just simply going out. These are places with low population density.
外科口罩，这个呢
Second
比刚
is
才前边提到的
medical
一次性的这种
surgical
外科口
mask,
罩呢
which
效
is
果防护效果还
have
要
a
好一些。
higher
那
level
么
of
这些呢，主要
protection
是推
than
荐给
type
我们的
1.
一些
This is mainly
有
recommended
发热的哈，
to
有
the
一些怀疑
people
它的这样的
who
一些病人
are
啊，包括公共交
experiencing
通的这些
fever
司
or
乘
might
人
be a
员，还有
suspected
出租车
cases,
司机
as well as
环
cab
卫人员
drivers
公共场所
and
服务的人员等等，在港期间呢，这个
cleaners
那么
and
这
service
是对于医
providers
用外科口
at
罩。
in
第三
public
种就是我们所谓的
location.
N95口罩啊，N95口罩，还
Type 3, N95,
KN95的这样的一个口罩，
or
还有以上的
KN95.
这些颗粒物防护的口罩，也就是说它对于
These are
一些更细小的
particle
颗粒
particle
一般
me-
大颗粒它就是受不
matter
了。
protective
那么它的这个防护效果呢，比刚才前面提到的
masks
两种呢还要更好一些。
which
这些
have
呢
a
是
higher
推荐我们进行一
protection
些主要是公共卫生的
effect
这些人员
than
进行现
the
场
previous
调查呀、
two.
采样啊，还有我们一
We
些做实验室
recommend
检测
the
的
health
做核酸
workers
呀
who are
病毒的一
doing
些检
lab
测的这些
check,
人
a
使
lab
用。
ex,
那么
lab
公众呢，
experiment,
在人员高度
or
密集的场所，或者是
investigators, social
这个密闭
investigators,
的公共场所呢，也可以佩戴，
and for people
就是
who
人
are
员高度密集的这样的一些场所。
going
可以
to
佩戴。
these places with
还有
high
就是
population
最后一
density.
种呢，就是叫医用防护口罩了。
Type
这个应该是
4,
最高等级的
medical
这样的一种
protective
专业用
suit,
口
which
罩。
is
推
the
荐给
mask
发
with
热
the
门诊、隔离
highest
病房的医护人员
protection
以及
level.
确诊
We
的患者
recommend
在
that the
转移时
medical
陪
worker
伴会
who
给
work
患
at
者
the
戴上
isolated
口罩也很重
wards
要。我们要求
as
在发热门
and
诊
as
发
well
发
as
热的病人也要
patients
给他提供这种
that
一次
were
性防护
admitted
的这种外科的口罩啊，所以 这个呢
to
是
these
推荐
isolated wards
最主要
and
我们说就是在红区里边的这些
ICUs,
医务人员要
so
使
the
用的。
so-called red zones.
那么这个呢是给大家提供的一个指引啊，当然是一个指引，
These
还是
are
要
our
看个人。
guidance.
那么我们也呼吁呢，大家尽量能够
And we
按照这
also
样的一个
appeal
指
to
引
the
来
public
科学合理的使
that
用这个口
you
罩。
use
其
your
实有的
mask
时候过度的
wisely
防护、过度
according
的
to
防
such
护
a
确实是没有
guidance.
必要。
So
那么关于您提到
overprotection
的第二个问
and
题，就是这些
panic
孕产
are
妇
not
如果一旦
necessary.
得病的话哈，能不能保证这个救治？那么其实
The
从我
second
们来讲
question,
呢，
after
我们
these
要求全
pregnant
国所有的
women,
这些
if
医
they
疗
were
单位啊，
diagnosed
我们已经
were
下达了一
diagnosed,
个通知，就是要求全国所有的医疗
we
单位
actually
一
ask
定
that
要
all
统
medical
筹做好肺
institutions
炎疫情的
to
救治和其他患
conduct
者正常
treatment
医疗需求之间
coordinately,
的这样的一个统筹的一个工作。
and they have to coordinate
那么
the
因为我
treatment of a
们
pneumonia
不仅是
patient
要
with
关注到
that
肺
of
炎
other
的这些
patient.
患者，同时我们还有更多的
So
患者
the
他还有正常的
uncov
这个医疗
patients are
需
not
求。
our only
所以我们要
patients
求呢，
in
其他的这些医
hospitals
院呢，为了
and
减
other
少
medical
人员瞬间就诊
institutions.
高峰，减少人员密集呢，通过
But
预
the
约挂号
hospitals
提
need
前
to
发出
do
告
a
示，
coordination
拉大这种就是正常门诊呀这样的一个开
in
诊
order
周
to
期。另
reduce
外，最主
the
要的这种互
population
联网加
density in
提
at
供
the
这种网
hospitals
上的咨询服
using
务呢，那么通过多
information
种手段呢，减
technology
少人员到
or
医院
online
就诊的这样的一
registration
种高
system
密集的高
to
峰会出现。
reduce
当然，必
the
须的这样的一
population
些急诊
density
手术和
in
急诊的病
hospitals,
人哈，那么不影响他们的这个就诊。那么包
and
括
also
像
make
孕妇
sure
她
that
得
the
病，包括孕妇在内
emergency
的所有的这
surgery
些
and
人
other
得病之后
emergency
呢，
patients
我
were
们要
not
求仍然
infected.
还要满足他们正常
For
的医疗的需
pregnant
求。那么
women,
最近我们也注意到
their
有一些媒
regular
体报道，特
medical
别是在武
needs
汉，
must be
就
met.
说有一些孕妇没有
According
地
to
方
some
再去做
report,
她
there
的
are
这个孕期
pregnant
保健，包括
women
有一些血液
that
透析的病人。因为
choose
他们
not to
原先
go
就
to
诊
the
这个医院
hospital
呢被
for
征用作为定点儿医院，那么这
appointment
一部分
because
病人
their
他的就医
hospitals
出
were
现了困
used
难。
as
针
a
对这个问
designated
题呢，我们也
hospital
要求
for
全国各
treating
地
pneumonia.
把
For
就
that,
是在征用定点儿医院的过程当中，一定
we
要把
also
原
ask
先的
that
就诊的这些病
after
人要登记造
turning
册。
one
每
certain
一个病人
hospital
都要给
into
他
a
办理好
designated
后续的
hospital,
治疗，
you
特别
have
是
to
对
do
于需要
follow-up
持续一
of
段时
its
间治疗的，
previous
像孕妇的
patients,
这个孕期保健，
especially for
还有血液透析的这
the
些病人。
patients who
我
need
们
to
要求
do
呢，
sustained
都要给他安排好
appointment
接
or
续性治疗的这
treatment.
个医疗机构，
For
一定要
for
登记造
example, the
册。
pregnant
而且
women,
呢，要把
as
他
well
的
as
之前的
those
就
with
诊的这些
kidney
病历资料，
diseases,
也同时要传递给下一个治疗的
and
中断治疗
transfer
任务的医疗
the
机构。
files
那
of
么
the
通过病
patient
历资料的
to
完整性
the
呢，也能够来
other hospitals that were chosen as a substitute
那么关于
to the
武汉
previous
的
one.
前一段媒体报道的这个问题呢，我们也跟前方组的同事进行了一个沟通，了解了一
We
下
also have
进展情况。
conducted with
那
our
据我们前方
colleagues
组的同志介绍
working
呢，
at the
现
front
在
line,
在武汉一些
and
这个孕妇她的就医的问题已经基本得到解决了。那么血
they
液透析
mentioned
的
that
这
this
些患者
problem
呢，
has
血液
now
透析呢
been
也
addressed.
基本上能够满足。但
And
是我们
for
由
the
于这
kidney
个血液
disease
透析的这个
patient,
透析机的使用，它每一个患者他透析是需要一定时长，所以他每天一台透析机能够透析的病人，他还是有限的。
especially for those dialysis patients,
班次哈，医务人员加大这种工作的排班的这个时长，那么来
because dialysis takes a lot of time to finish. Therefore, the medical workers have to increase their working time to ensure that these patients can get timely treatment.
来，这位女记者，靠早到的。
中央广播电视总台央广记者提问：在重症患者医疗救治的过程中，哪一个环节
With
是治疗的关键
CMG,
难点？
what
对于
is
这些难
the
点，
most
是如何
difficult
解决的呢？目前武汉当地的重症患者医疗
link
救治
in
中有没
terms
有
of
相
the
关的经验
treatment
可以
of
给我
severe
们的其
cases?
他省份和
Are
基
there
层
any
的医疗机构借鉴
experiences
的呢？
to
谢谢。
learn from for other provinces in terms of treatment of critical
请郑老
patients?
先生来回答一下。
因为您谈到属于这个重症病人救治的难点是吧？因为说从临床救治本身来讲，那我们还是讲
In terms of clinical treatment, we have always given priority to scientific
也就是说我
treatment,
们现在对这种
and
病
you
毒
can
性疾
refer
病
to my
没有
previous
特效
answers
的药物治疗。
in terms
那
of
么我们所能够
treating
做的就是
the
给予病人
virus-related
支持的疗法。实际上我
disease.
们经常讲
So our
在
main
人类
treatment
科系统
is
我们内
supporting
环境
treatment.
包括我们的营养的支持，
For
包括病人休息
example, nutrition
包括病人如果说
support,
有咳嗽，我们要止咳。
make sure that they
病人
have good
这个
rest,
呼吸困难，我们相应的给予他
and
不同级别的氧气的
coughing
这个
relief,
鼻导管吸氧
oxygen
高
supply,
高通量的这个高流量的这个鼻导管这个营养，包括我们的有创无创呼吸机，甚至包括我们
and
的
the usage of
那么
ventilators
这些系统
and
都保
ECMO
证了
support
对
system.
重症病人呢
All
一个
of
很
these
好的治疗
methods
各层
can
次级别
help
病人
us
给一个治疗
to
支持。
sustain
当然
a
大家都希望
balanced
这样病人
physical
经过治疗
condition
之
for
后
our patients.
基本上都能够有一个很好的一个救治率。
After these
但是来讲
treatment,
这个
most
病毕
of
竟
the
它是
patient
是个
can recover
基
from
本来讲
the
病人每个人的结局是
heavy
不一样的
syndromes.
那么有些人来说
However,
你再怎么经过治
The
疗
result
包括我们
differs
说
from
重症
one
病
patient
一些
to
有基
another,
础病人甚至包括我们的青
despite
少年人
all the
那
efforts
么
we
都
put
如果
in.
严重疾病
For
过于
some
严重的
of
话
the
可能我们医生
patients
尽
with
了力了，但是
diseases,
并不一定能够把
or
这个
even
病
some
治好
younger
这个
patients,
大家还是应该可以
they
但是我们
still
在救治过程中呢，
fail
我们会坚持
to
我们医生应尽的
to
职责
make it
这是
through.
我们应该做的事情。这点我想，大家还应该了解。那么
But
还有
the
就是
medical
还有
workers
这个
are
基础
doing
的
all
病
that
病
they
呢
can.
大家总是讲，哎呀，怎么要给他积极救治，是要积极救治。那么不是说我们积极救治之后，那病
We
人
are
都能
sparing no effort
这个大家我想
when we
应该
are
积极
treating the
支持还
patient.
是有正确的
That's undoubtedly.
对于重症这一块呢，可能刚才兴旺主任呢，他是从专家技术层面来讲。那么我想呢，从我们作为管理层面来讲呢
So,
中央
from
还
an
有
administrative
也算是提示
perspective,
给其他省呢
I
算
have
是一个经
several
验算是一
additional
个
points
需
to
要有
make
重视的哈。
as an
就是
reference
第
to
一点，首
you.
先我们强调的还是要呼吁这些患者呢，
First,
如果
we
一旦出现这些症状呢，还是要
want
及
to
时到
appeal
医
to
疗
our
机构来就
patient.
诊，因为我们分析
If
的
you
数
are
据呢也
showing
显示啊
symptoms,
我
make
们
sure
这
that
些
you
死
go
亡
to
的
the
病例当
hospitals
中
for
呢，有一些
treatment
人他早期的时候，
because
他
many
从这
of
个
the
发病到
death
就诊的时间
cases
还是很长的，这样的话
ignored
实际上
their
就耽误了他
symptoms
那
and
个
early
宝贵的就
stage.
诊的时间。那么他一
They
入院
waited
的
at
时候就
home
是一个
for a
重
very
症
long
状
time before
那么我
referring
们
to
在这
the
个现在随
hospital.
着防控的
So
这种
he
力
was
度和大
already
家
a
控制
severe
程度不断的
case
加大。
case
现
upon
在我们在
admission.
分析这些死亡病例，就发现呢，他们就是有很
So
多
when
的
we are
临床的这些
analyzing
病例
these
那么
death
从他的发病到
cases,
就诊的时间是在缩
we
短，就
found
说明大家
that
就诊的意识在增强了。所以我想这个是首先
right
一
now
点
more
是
and more
很
people
重要
are
的，就是一
seeking
定别拖
medical
到已经
help
很严重的时候再去
with
看病，这个是要强调的第一点。
relatively shorter period
那么
of
第二
time.
点呢，就是我们在诊疗方案里，我们的专家呢，在总结这些病例资料的时候
And
也提出来
second,
呢， 就是有一些人他是高危人群，我们要关注
For
这些
some
高危人
patients,
群，比如
they
这
are
一次
high-risk
非常明
groups.
显的就是高龄和有基础疾病的这些老年人。
And this time
因为
it
我们
is
在临床上
the
提示这些
elderly
医生呢，对于这样的
population
一些患者，我们
with
就要引起高度
fundamental
重视，
diseases.
要给予这个
They
相
are
应
the
的
ones
治
that
疗，
we
不要
have
让它
to
从
give
轻症状态
priority
发
to
展成为重症状态，这也
to
是一个很关键的
avoid
一个
a
时机
patient
和关键
going
的一个
from
点。
light
那
syndrome
么第三个
to
点呢，
heavy
就是
syndrome.
前面其实我已经提到了，我们现在这些对于重症集中收治采取的是叫综合治疗。综合治
Thirdly,
疗
we are now
所以呢，一
conducting
定要有一个
comprehensive
综合
treatment.
治疗的方案和这个医务人员的团队啊，采取一个综合的治疗。
So
这样的话
teamwork
呢，对
and
于取得
collective
一个
treatment
相对理
is
想的治疗
important
效果
in
是具
terms
有
of
非常重要的作用。
treating
那
patients
么另外
in
一点
critical
也是我们
conditions.
政府的相关部门，就是从武汉和湖北的这个情
For
况来看，
relevant medical
为什么武
departments,
汉
other
它的现在
departments,
这个重症病例比较多，并且死亡病例比较多。
we found
那么还有一点就是
more
刚才
case,
前面
severe
提到
cases
它
in
一个人分
Wuhan
散
and
在
death
这个医
cases
院，另外呢，这
than
些
any
医
other
院它
places.
没有那么多的这个 ICU 的治疗的这些设备。
A lot of the
就是它的
hospitals
设
are
备实际
lacking
上
ICU
供
and
和
supporting
它的这个每天
equipment.
发生的重症的病人的数量，这个之间的差距太大了。 没有
Or
这么多的设备，所以呢，
there is
我
a
们
very
现在也
big
积
gap
极地在
between
全
the
国
demand and
在调
supply
这些
when it
刚
comes
才
to
希望你提
usage
到的像
of
呼吸机
these
啊、监
life
护
support
仪啊
system.
这
So we
些
are trying
重
to
症监护室里边
transport
的
more
必备的这些
much
设备，我们
needed
在武汉
equipment in the
调。因为我
ICU,
们
for
现在有
example,
1000
life
多张的
support
重症的床位，
equipment
那
as
么我
well
们还
as
要为这1000多张的
ventilators.
重症床位来调集这些相匹配的
We
设备，
have
这一
more
点
than
非常重要。
1,000
那么也提示其他的地方
critical
一定也
critical
要
cases
提
beds,
前要
and
做
we are
好
trying
相
to
应的
equip
这些医
these
疗
beds
资源
with
的
necessary
储备和
medical
统筹和协
equipments.
调，这一点也是很重要的。谢谢。
时间关系，我知道还有媒体有问题，但是
I know
我们
that
今
you
天
have
只能
a lot of
因为
questions,
亚
but
辉
due to time
部长
constraint,
马上就要坐火车，
we have to call it a
他要
day
到那儿来
because
去组织和
Ms.
指
Jiao
导
will
当地
be
的
catching a
病
train
患
to
者
go to Wuhan to
还有
guide
全
the
方面的这个
treatment
患者的这个医疗救治
of
参加到前方工作组
of
中去
the
所以呢
patients
我们
there.
今天的这场发布会呢，就暂时到这儿。明天呢，
So
我
that's
先
it for
预告一下
today's press
明天我们
conference.
3点同一时间的新闻发布会。
Tomorrow
仍然
we'll
是
see
围
you
绕大
again
家
at
关
3
心的医疗
p.m.
救治的整体工作安排来回答
and
大
we're
家的
talking
问题。
about the
所以今
arrangement
天
of
没有问到的
medical
问题，
care
明天可以
and
带到发布会
treatment.
现场来
So you
报
can
信息。
continue
今
asking
天的
your
发布会就到这儿，
questions
谢谢大家。
tomorrow.